Welcome to Fueling Conversations, a sport nutrition education network podcast with Dr. James Fleming. In today's episode, we're joined by Professor Peter Fine, a specialist in sports dentistry, to discuss the crucial link between dental health and athletic success. Professor Fine highlights the unique risk athletes face, from high carbohydrate diets to frequent sport drink consumption, which can lead to tooth decay and erosion. He emphasises the need for better education among athletes, nutritionists and medical staff to incorporate oral hygiene into overall performance strategies. We also dive into the research on the connection between oral health and systemic health, the role of mouthguards in concussion prevention, and emerging sensor technology that measures pH levels in the mouth. Plus, Professor Fine shares practical tips from hydration habits to fluoride toothpaste and regular dental checkups to help athletes protect their smiles and their performance. This is an eye-opening conversation about the often overlooked aspect of sports science. Let's get into it. Hi everyone, and welcome to this episode of the SNEN. We're in for a really good one today on a hot topic about dental health in athletes. Really lucky that we've been joined by Dr. Peter Fine from UCL, who is a specialist in this space. And we're really keen to get Peter on because it's a topic area that athletes and practitioners are very aware of, but we probably don't know what to do. So thanks for joining us firstly, Peter.
You're welcome. I look forward to it.
Would you mind introducing yourself a bit better than I just did there? So tell us a little bit about what you do, your background, and where you currently are.
Okay. So, yeah, thanks very much indeed for the invite, James. It's a real great opportunity to talk to you guys. This started for me a long time ago because in my general clinical practice, I used to see quite a lot of athletes. And I noticed that many of them had huge dental issues. They had a lot of decay, they had a lot of gum disease, and a lot of erosion of their teeth. And then I got invited at UCL Eastman Institute to run a program on sports dentistry, which was initially a CPD program, and we've now developed it into a full MSc. So it's still the only MSc in the world on sports dentistry. So I run that. The director of that currently, and I'm also director of our restorative dental practice program and professor of dental education here at the Eastman. So that pretty much is me. I get asked to do quite a lot of talks internationally and nationally on sports stuff, and that's really great because it gives me the opportunity to sort of get out there and talk to people about something that I'm passionate about, but something that is perhaps under researched, perhaps, but also something that is little understood by some of our medical colleagues.
That's interesting, and I think I only kind of came to terms with this when I think you asked me to do like a recorded lecture during COVID about the carbohydrate recommendations for athletes, and it was only until that point I thought, hang on, I don't really align the two things. I never really thought. I was like, okay, yeah. Carb recommendations are going up. Use of refined carbs have always been a thing, but citations of 120 grams per hour is common now in elite sport, and that trickles down to sub-elite for sure, and bad practice and all those other things, highly processed foods and everything else that we're aware of. So it was really interesting that kind of came into my mind, and I've posed the question at multiple conferences to practitioners and yet to get a response that's kind of tick the box, if you like. So I guess, do you mind introducing kind of the importance of dental health for athletes in general and why they might be considered a high kind of risk group? And I kind of alluded to that a little bit just then.
Yeah, sure. I think probably what I should say to start off with on that is the importance of dental health, full stop. Because, currently in the UK, we are, in general practice, we're seeing a lot more oral health problems, dental decay, gum disease, this sort of thing. I think some of it is the well-publicized sort of NHS restrictions in terms of people actually finding a dentist. That's part of it for sure. But I think what we understand now is the link between diet and oral health to a very large extent. We've always known that sugar is a tremendous problem to teeth, but it is only a problem really because people don't actually look after their teeth particularly well. So this combination of getting sugars in the diet and lack of and poor oral health sort of combine to form this perfect storm, if you like, and decay and gum disease and so on. I think one of the problems that we have, and we continue to have, is the fact that when we say to a patient, how much sugar do you have in your diet? They say, well, I only put two tablespoons in my cup of tea every day. And we then have to talk to them and try and educate them about, well, actually, that's fine. That's one source of sugar. But, there are sugars in fruit. There are sugars in lots of processed foods, all this sort of thing. And we need to make them very much aware that that's the situation. Now, it's exacerbated really in terms of our athletes, and particularly we're looking obviously at elite sport here. Because, if you take, we've all been watching the Olympics recently. If you take an Olympic oarsman, he needs to consume 7,000 or 8,000 calories a day in training every day of the week. And of course, they're continuously eating carbohydrates because that's a great source of energy for them. And this continuous bathing of the oral tissues with carbohydrates is a real problem for us as dentists, because if they're not cleaning their teeth properly, then the carbohydrate mixes with the plaque, bacterial plaque around the teeth, which is left when they don't clean properly, and causes an acid, and that acid causes demineralization of the enamel, a cavity forms, toothache starts, and the athlete is then in trouble because sort of personal experience, I've been phoned by athletes on a Friday evening saying, I've got toothache, Peter, can you see me in the practice tonight? Because I've got a match tomorrow and I need to be fit and well to do that. So I think that's part of it. I think that's a big part of the story. The other part of the story now is sports drinks. And we are definitely seeing, there's mixed evidence on this, in fact, in the literature, but anecdotally and some evidence, we are seeing more cases of erosion of dental health, of dental materials, as a result of athletes using more and more sports drinks. And it's interesting to note that when you look at, I won't mention any proprietary names, but when you look at some of these sports drinks, they've got a pH of about 2 or 3. And what we need to do is to try and educate our athletes. We might come on to this later. Educate our athletes when and how to drink these drinks. Because I've realized over the years that I'm not going to, if an athlete thinks that taking a particular sports drink is going to help their performance, then I'm probably not the right person to change that view. But what I can do is perhaps offer some advice on how to mitigate against the potential damaging effect of that sort of 2 pH liquid that they continuously drink all day long.
It's really tricky, isn't it? Because I'm just thinking about those thousands of calories with people training all day. The gut, you don't want to have the gut full of food. You can't train, you can't optimize performance that way. So a lot of people are leaning towards, and some of our guidance is to use liquid nutrition. So, your smoothies, all of these aspects that, will obviously have a hit on your teeth. And it's kind of a catch-22 because they need the calories, they need the energy. They can't have it in their guts. What's the right way of doing it?
Yeah.
And not having that fundamental in place to support general kind of oral hygiene. And we'll come to that as a bit of a practical recommendations later. And it was interesting because what you said there is I kind of have more and more interest in talking to my dentist, and I think they hate me now because every time I go, I ask more questions. And they said to me before, James, you should be limiting your teeth to 3 hits of sugar a day. And I said, that sounds great in theory, but in practice, and I said, I'm a sports nutritionist and I'm recommending, the guidelines are saying here. And unfortunately, they kind of look at me and go, oh, I don't know what to do here. And then I go home and have a debate with my wife who says, well, that's what they've told me to do. So we're going to try and do that. And I just think it's really tricky. So I guess, can we tap into some of that current research? I know you've been leading the way on some of this too, but can you give us a bit of an insight into what the research is saying? And then we'll go into some of those practical tools later and we'll make sure for those listeners that we make reference to the papers we're going to talk to here. And there's a really nice infographic that I'm going to share too that Peter and his team have put together too. So that'll be really useful for you guys to have and use with your athletes and in your practice too moving forward.
Yeah, well, I think the research that we're doing falls into 3 or 4 categories really. There certainly is still research going on into the link between. This is really important for athletes, actually, really important, because we now know that there's a link between poor oral health and athletic performance. One of my colleagues, Dr. Julie Gallagher, did her PhD looking at specifically that point. And, we've known for some time that if patients don't look after their teeth properly, then many of them develop cardiovascular problems, develop diabetes, obesity, that sort of thing. And whilst obesity isn't perhaps relevant to the elite athlete, it's nevertheless a link between poor oral health and systemic health. So we know that obviously we don't want our athletes to develop cardiovascular problems, because whether they're an endurance athlete or a high-speed sprinter or whatever, they need their cardiac system to be in good working order. So I think there's a bit of a link there going on, and we definitely have got research to show that. I think the other aspect is with we've done a lot already. We've done a lot of research. I've just sent a paper to hopefully get published, linking the screening of athletes. We do quite a lot of screening, and we've shown in the past that this is quite valuable, because we have shown that actually if we screen elite athletes on a regular basis, we can actually improve their oral health. So we will go into a club, for example, rugby club, football club, hockey club, whatever, and pre-season typically we will be part of medical screening that goes on to those athletes and advise them if they need any urgent treatment, or if they need any intermediate treatment, or if they can they'll be fine and they just need another review in 6 to 12 months time. So we're doing some research into that and looking at how we can really pinpoint that and help the athletes in terms of educating them, but also educating the wider athletic team, because this might be a little bit near the mark, but we don't talk to you guys enough. We definitely do not talk to nutritionists enough about joint problems, in terms of oral health. So I think we need to establish better links, if you like, to do that. The other sort of interesting aspects of research that we're looking at the moment is particularly controversial topic, perhaps, and that is concussion. Because we're quite involved with concussion research, because there've been 1 or 2 studies looking at the link between wearing a mouthguard and concussion. 1 or 2 studies, there's a group in Calgary in Canada at the moment who are absolutely convinced that wearing a mouthguard prevents concussion. And their data does show that in a certain age group of ice hockey players, wearing a particular type of mouthguard can actually have a beneficial effect on the level of concussion that their athletes experience. My concern with that is that it's not generalizable to all sports and to all athletes and to all types of mouthguards. And in fact, 2 of my students have just done systematic review looking at whether the literature tells us that there's a definitive link. And in fact, we've come up with the answer that actually no, there isn't really very much evidence at all. And what there is quite limited to link the 2. So that's an ongoing line of research that we're doing. Linked to that in a way, I suppose, are these now called smart mouthguards.
Yeah.
We can actually measure the impact. This is particularly relevant in rugby, I think.
Yeah, I've been doing some work at Harlequins women, and they've been
using well, one of my students is doing some work with Harlequins women. Nice. So hopefully you can link up with her. Yeah. But the problem is that we want to look at if we can be of any help and benefit. So we've developed this sensor not us, but it has been developed. And we're putting it into Mouthguards. And what it does is it measures impact. So we can now actually sit pitch side with a laptop and get readings of impact for these players in practice and in match situations, and say, that player over there, if he gets one more impact, he's going to be concussed, because concussion can be a sort of a cumulative type of thing rather than just a one-off hit. I think what we have to do in that thing is to look at the design of this mouthguard, because there have been some issues with mouthguards failing, because whoever's made them has forgotten that actually the mouthguard is there to protect the teeth and mouth, and have made it too thin where the sensor is, and therefore it hasn't actually performed its function properly, or potentially hasn't. I don't know of any examples of players actually having teeth knocked out because the mouthguard's been too thin, but there have been occasions where the mouthguard has fractured, and that's because the sensor has been in a thin part of the mouthguard. The other aspect of that sort of research that I'm just involved in now with a couple of students at UCL Engineering is we're designing a sensor that measures pH. Now, this might be very useful to athletes, because what we can do is, at the moment, all we can do is measure the pH of saliva on a particular moment in time with litmus paper or something like that. But this sensor that we're designing, and my role is really to design the mouthpiece, is going to be able to measure over 24 hours or 48 hours, however long the individual wears the mouthpiece for. And this gives us a huge insight into when they're getting rises and falls in pH. And then we can perhaps mitigate against that by looking at their diet, looking at when they're consuming certain foods and drinks, and so on and so forth. So I think that's really quite exciting. So I think those are the sort of areas of research that we're currently working on.
Is that going to be rolling out across athletes soon once that's been designed?
Possibly. I think the initial aim is to, and we've got a survey out to general practitioners, general dentists, about whether they'd be interested in using this type of appliance with their patients. So I think it's a very short step then to say, right, well, let's roll it out to athletes as well. They're still working on the electronics, which I don't have any expertise in. As I say, my role in this is to design the mouthpiece. But yeah.
So I guess moving forward, and I think I know we discussed how this might be quite challenging, but could you give us a few ideas about the practical tools or strategies to mitigate when we are in a situation where we're at high risk of continued acidity or continued attacks against the gums? Because there could be cases where we can try to deal with nutrition, try to switch the right foods and drinks, and try to be kind of conscious. But there might also be occasions where it's unlikely that we're able to do that. So, yeah, can you give us some insights into how we can perhaps help our athletes that way and ourselves?
Yeah, absolutely. Well, I think this is a really interesting and very important aspect. Can I just start off by telling you an anecdote, because I think this sort of sums things up quite nicely for me. A few years ago, I was talking to British hockey medics and physios and so on, and it was largely about trauma, which happens. And then the next speaker got up and spoke about their new sports drink, and how it would resolve all their problems. Anyway, someone in the audience said to them, what's the pH of your sports drink? And the lady doing the presentation said, well, I really don't know, but why is that important to you? And they said, well, our previous sports speaker had mentioned about the pH of sports drinks damaging teeth. And she just didn't know what the pH of this drink was. But what was even more worrying was she then said, well, I'm not too worried about what drink they have in their bottle, as long as our logo is in front of the cameras when the cameras are rolling.
Yeah.
And this was sort of, to me, was the ultimate insult in terms of marketing, because clearly one of the main things, getting back to your question, one of the main things that we have to do is educate people. And I see my role, particularly as an educator, that I need to educate doctors, nutritionists, physios, athletes, managers, as well as educating sports dentists of the future. And I think that education is really at the hub of this whole thing. I think that one of the things that we realized a while ago is, as I said earlier, we're not going to stop an athlete drinking whatever sports drinks they think is correct. But what we can do is we can mitigate the potential damage that can do. So very, very simple thing, with your sports drink, don't sip it for 2 hours. Drink the whole thing in one go. Get the fluid inside you, get the electrolytes back inside you, and that's it. But then just rinse your mouth out with tap water. Just rinse, for 2 or 3, 30 seconds maybe with tap water. If you don't want to swallow it, fine, spit it out. But then what you've done is you've neutralized the acidic attack, and hopefully that will help. I think the other thing, of course, is that we need to get athletes using fluoride toothpaste a lot more. Now, the normal sort of Colgate or whatever that you buy in the pharmacy has got some fluoride in. But what we can do is we can prescribe toothpastes for susceptible people. And this is where my screening comes in, because we can pick them up, which is maybe 5,000 parts per million fluoride. And this really can reverse the process of decay when it's in its early initial sort of demineralization process before actual cavity is formed.
Just a quick one, sorry, please, just for me and other people. So fluoride in a normal Colgate compared to what you can prescribe, is it 10 times more, or what are we looking at in terms of numbers?
Well, it's probably at least 10 times. I would think maybe more, 20, 30 times more. So we can do that. We've got gels that we can apply to susceptible areas. We can, we can get the athlete we can give a prescription for the athlete to then get the fluoride toothpaste. But simple things they can do, which actually have quite a positive effect. So, for example, after you've brushed your teeth with your normal Colgate or whatever, don't rinse your mouth out. Just leave whatever residue of fluoride toothpaste is in there, because actually that does have quite a beneficial effect on strengthening these potentially weakened areas. I think we need to talk about actual oral hygiene techniques. So, I can say to any patient, oh, why don't you floss your teeth? Now, I'm not stupid enough or not naive enough to think that every patient of mine is going to go and floss their teeth twice a day. But we've got other aids that are very much easier to do. And it only needs to be done once a day. But it needs to be done on a regular basis. So I think this sort of combination of not rinsing out the toothpaste, using maybe high concentrations of fluoride, good brushing techniques and cleaning techniques, and of course, regular checkups.
I mean, exactly, yeah.
I mean, I've just finished a study that's been published, that's being hopefully going to be published in the British Journal of Sports Medicine. It's a follow-up study, because in 2015, we published a study that looked at elite professional footballers in England. And we found huge amounts of decay in these players. So this study that I've just done is in academy players, so 16 to 18-year-olds. Because I think if we can educate them and their physios, nutritionists, etc., then hopefully we can prevent the problems that the seniors get when they're in their mid-20s, early 30s. But we found huge areas of decay, gum disease, etc. What we found, which was really worrying in this particular group, was areas of not just erosion, but erosion that was possibly linked to bulimia.
Wow.
And this is classic in dental anatomy that we can detect these sort of eating disorders because of the pattern of erosion that we see in some of these patients. And these were 16-year-olds that are now going to need some sort of restorative dentistry for the rest of their lives because they've destroyed large amounts of their teeth.
Excuse my ignorance, but with the bulimia, is that because of the acidity that's coming up from the
Yeah,
regular?
yeah,
Um,
because they're vomiting up,
mm.
and the acidity of the gut contents is really low pH, and it's just dissolving teeth.
It's interesting, isn't it? Because it kind of feels like it's not like a lot of new sports nutrition when you get to it. It feels so simple, some of these strategies, but how many people actually know? Or if you were to do a survey of 100 people, how many people do keep the toothpaste in their mouth, don't spit it out? How many people do some form of flossing or extra care? How many people actually correlate the link between oral health and general health or longevity
Mm.
of well-being? Because we always say this, you can be a top end athlete, but that's a short career. We want to make sure we're going to be healthy and have a
Yeah,
prolonged
yeah,
life. We want to make sure our well-being is there first so we can maximize everything. And you've already established a link between health, performance, all of those things really nicely. I love the idea that you guys are going and doing some screening. I think in my experience, it's few and far between that there's been dental awareness in professional sport. I think it's a space that I think we need to tap on the door more as nutritionists and say, can we get in? The
yeah,
likes of yourself and your students are leading the way because fundamentally there's so many screening opportunities throughout the season, and we screen for everything.
yeah,
So having
yeah,
it, and you're not talking about something that's going to be arduous necessarily. Making sure they understand that link is huge, and you might only have to tell people once or twice, and it's there. But like you
yeah.
said, I guess there is always the, have you actually got a dentist? Do you go every 6 months? Do you think about, I mean, how important is, and I don't know, I'm conscious of time, but how important is a hygienist as well? Because that's something that's come into my life probably the last 5 years.
Yeah, yeah,
I'll be
yeah,
honest, my NHS ran out when I moved house, and I couldn't find an NHS dentist for a couple of years. So I've been really strict on it since. And
yeah,
it's a bit of an
yeah.
insight into the importance of potentially seeing a hygienist every 6 months or 12 months.
Absolutely. I think they're a important part of our team. And even if, I mean, I see a lot of young people now who have got no decay. They're doing really well, not athletes necessarily, but young people generally. But they all need to see a hygienist at least twice a year. And some of the elite footballers that we see, particularly, are in in real need of a hygiene visit on a very regular basis. And the good thing with the hygienist is not only do they clean your teeth, but they actually reinforce the message. And it's this reinforcing the message on a regular basis that I think then begins to have beneficial effects. No point in doing it just once. That doesn't work. We look at sort of behavioral changes and things like that, and trying to change people's behavior is a very difficult challenge. But regularly repeating that message, yeah, I think that does begin to work. They listen.
And where can we, or those that are listening to this are performance nutritionists, S&Cs, physios, where can we find a sports dentist and not just a general dentist? Is there anywhere that you'd recommend that we could kind of have a starting point if we were able to kind of push this agenda and start adding it as part of our screening or as part of our kind of toolbox as a support network and multidisciplinary team?
Well, yeah, actually, funny enough, we're just launching Sports Dentistry UK, which is going to be a group of sports dentists that have many of whom are alumni of my program. So that's always helpful. But some are not, but they are very experienced in doing exactly the sort of things that we've been talking about today. So there will be a sort of register of these people around. But if for example you had someone who said to you, "Where can I find a sports dentist?" then I'm more than happy to recommend someone in a particular region that I think is would be helpful to you.
No, that's so useful. I think this has been such an important topic area that we just brush over. And I know that as myself, from as a lecturer in this space, the guidelines on types of foods, quantity of foods, always seems to go up and up and up. And it almost feels like a disservice that we kind of don't get into detail on this or actually protect the athletes properly. And it seems like, again, I'm maybe a bit facetious here, is that maybe in some cases it's, well, they're an athlete, they're my athlete, they do what they need to do for performance. And sometimes there's a mismatch between performance and health. And
Yes.
sometimes
Yes.
athletes can be seen as, well, you're mine and this is what you're here to do. And I think as nutritionists, we need to be very mindful that it is health and well-being first before anything else. And we're in a position where we can challenge and bring in and have a positive impact. So yeah, thanks so much for your time. I think this is
pleasure.
super valuable. I will share your bio. I will share some of the papers we've discussed today, and also that really nice infographic for the listeners.